Africa is a very diverse continent. But if you look at the overall data, it's 16% of the population, but only 2% of the health expenditures globally, which total at $9.7 trillion. But only 3% of the healthcare workers globally are in Africa, despite Africa bearing about a quarter of the global disease burden as it's described. Yeah. So we all see the data. Can you take us inside the healthcare system? Because that's obviously why we talk about flattening the curve, right? Because of the pressure on the healthcare system, which is already, according to these data, weaker in Africa potentially than other parts of the world. Could you take us inside the system a little bit and how it's working in the context of COVID-19?
What we're realizing is that the question around health system is also a universal issue, because at the same time Africa has been trying to flatten the curve, and so far, based on the information that is available, we seem to be in a zone where the implications of COVID-19 are mild for now, and the economic impact will be much stronger. But if we then think about what is the ideal health system that we're looking for in our communities, number one is to rethink the whole point around last mile compared to first mile. I think first mile should be the rural area because that's where most people start and move towards the city. So what kind of health facilities do we need to put at the first mile so that diseases that can be picked up early enough are diagnosed and treated? Once we advance the question around thinking about the rural area as a starting point, we will make progress in the health system. A lot of the best health facilities are concentrated in urban areas. But at the same time, we know today that the majority of Africans live in rural areas. So from a policy perspective, we have to think of a way in which diseases are detected early. So let's take, for example, a group of diseases like neglected tropical disease. There are 20 diseases. You may be familiar with some of them. Elephantiasis is one of them, where you have a swelling of feet. You also have worms that affect children that go to school. So what is the impact of ensuring that every child is dewormed? Probably improvement in access to school. So the question of health system, yes, there are a few diseases that have been sort of supported by donors like HIV, AIDS, TB, and malaria. Others are not necessarily. So we need to ask the question in COVID-19, how do we ensure that anyone that accesses a health facility has access to health, regardless of which diseases they may have? Which means the whole architecture of health funding or health financing needs to start to shift more and more towards health system strengthening.
And finance becomes a pretty important part of our experience with COVID-19. I think I've seen different estimates, but initially I saw an estimate that it would cost about $200 billion for Africa to fight COVID-19. And at the same time, many countries in Africa already carry a heavy debt burden. There's not a lot of what we economists call, as you are, call fiscal space in order to fight from a financial perspective this disease. But at the same time, I know that there are efforts to pool resources. I remember talking with you last year about your belief that much of financing could be driven by the improvements in the household income, both inside Africa and with the diaspora. And at the same time, we have been starting to move to a more integrated Africa. How does all this fit together in a way that gives us hope for the way we might be able to finance this fight? And especially as you've noted, the world after COVID-19 is really a world with COVID-19 on an ongoing basis.
So the debt, if you read on the debt discussion about Africa, we certainly not in a position where we have borrowed too much, because borrowing is always about what the money is used for. Africa has been, for the past 25 years, growing continuously. It's the first recession in 25 years that we're going to hit, which means that part of the borrowing have probably been used to a good effect. So I don't think we should just look in terms of the debt situation, but there's also a question about the interest rate. Most African countries pay more in terms of interest rate than the rest, and because of the perception of risk. So this is probably an opportunity in that context to try and also rethink the way we look at risk for an African country. I also think that when it comes to the economic situation, it's going to be very difficult. There's no doubt about it, because when people are not able to move, the activity which is related to all the different aspects of it is also at a standstill. So if you take the airline industry, for example, Ethiopian Airline has been one of the best airlines in the world, and today they cannot fly. And if they can't fly, the world is not designed for airplanes to be parked on airports. Therefore, there's a number of costs that accrue to this particular situation. We're also in a position where it is hard to say exactly what this will look like in months to come. But one thing which I strongly believe in, it gives us an opportunity as Africans to ask ourselves a question around how do we pool our resources. The Africa CDC, for example, which didn't exist 6 years ago when we had Ebola in West Africa, now exists, which means that you can actually coordinate the response for a pandemic on the African continent. That's exactly what they're doing. But they need our resources. If one individual in diaspora can actually contribute $20, $50 and pool these resources, we then have an opportunity to ensure that we have what it takes with domestic resources, with also resources from the diaspora, with an Africa CDC which is fully funded. I strongly believe that is important because in 1951, when the US Center for Disease Control was created, it was born out of the elimination of malaria in the United States of America. So being in that position where we use our resources to strengthen institutions provides an opportunity to ensure that there is continuity in the response. There's also things that we have learned that we can just continue to replicate and adapt. And if you look at the response to COVID-19 on the African continent, the fact that we have had different pandemics has allowed us to probably understand certain things that we could do better and do our best to limit the challenge. But the productive means of all these respective countries can no longer be a national response. It has to be a regional or Pan-African response. Therefore, the Continental Free Trade Area, which was supposed to be, I think, launched in July, has been postponed, unfortunately. But this is a time to really push forward, because integration in times like this is a key to accelerate the recovery. We can't stand behind borders and expect that countries on their own will be able to resolve the matter. It's not possible.
Yeah. How do you see talent development and education, especially management and entrepreneurship education, fitting in, not necessarily right now, but as a result of this experience? Do you see more emphasis on this?
So when you have across the continent and other parts of the world 15,000 people, those are 15,000 different skills that you can use in the community. An NGO, for example, facing challenges in terms of AML, anti-money laundering, can receive support from an employee on helping them to go through that. It may not have a direct monetary value, but the positioning of that NGO in the community and also vis-a-vis Africans donor or external donors will be strengthened. Or we can look at marketing skills. You can look at leadership and development. That is one of the key aspects of Ecobank Academy. The reality is that you will need more people that understand the art of leadership and not necessarily the position of being in leadership. there's a difference between the two, in my view. The position allows control over resources and also direction. But you can have someone, for example, who chooses to be a leader in his community. And that leadership does not necessarily come with a position, but it comes with a vision that something needs to change and they're willing to do something about it. When it comes to learning and development, the fact that physical proximity becomes a challenge raises a question as to what is the network of your school who do the infrastructure. If people cannot come back, how do we ensure that wherever they are in the world, they can first give those skills to the community, either free of charge or at a reduced cost? Because ultimately, the ability to navigate the world in which we are with skills that I will call adaptive learning is probably one of the best skills that your network can provide with, of course, Ecobank Academy. Because we're not too sure what it will look like when this will subside. But what we know is that the way we've been teaching and the way we've been learning will be very different. And that difference will definitely come from the ability of those that are custodian of knowledge and custodian of giving knowledge to ask themselves a question: what skills can enhance the ability of somebody living and working in Kibera, for example, so that they can insert themselves into these global value chains or these African value chains. So there will have to be an assessment of what is already available, because we go from the principle that people already have a certain level of skills, and that these skills need to be enhanced in a specific context. And that shift means that you will need to have more localized learning. It can be designed centrally, but the local knowledge is extremely, extremely important.